Hello everyone and welcome to Softfeel Academy's webinar. We are so glad to welcome all of you tonight. Thank you so much for connecting. Thank you so much to our team of experts for being here with us tonight. I am Hannah Tebeka Azriel and I will start introducing this webinar, introducing our speakers and telling a little bit about Softfeel. And then I will let the speakers talk about the heart of the issue tonight, Topilase. I am just, trying to change the slides. All right. So the theme tonight is everything on Topilase, the new topical hyaluronidase. To speak about this, we are welcoming four speakers. First, Dr. Sandrine Sebban, who is an aesthetic doctor from France. Dr. Sebban is the creator of Softfeel. She is also the creator and the inventor of several micro-cannula injection techniques. And she is the inventor of Topilase. So it is a great honor to hear her insights tonight and understand why she created Topilase and speak about the product. Then Dr. Ambroziak will take the speech. Dr. Marcin Ambroziak is a dermatologist from Poland, and he was part of the international expert study on Topilase. So he knows the product very well, and we are very excited to hear about his results with Topilase and how he uses the product. Then we are welcoming Dr. Jesus Chicon, who is an aesthetic doctor from Spain. He's a dear friend of Softfeel and a Softfeel Academy trainer for many years, so he knows all of Softfeel products so well. It was just very normal for us to invite him tonight, as he has been using Topilase for more than a year. And Dr. Paola Molinari, who is a plastic surgeon from Italy, and she also was part of the international expert study on Topilase. And she has great insights, and she will give all of you amazing advice on how to use Topilase, and she will show us her clinical results using the product. So thank you to all of you.
Thank you. Thank you, Anna.
So a little bit about Softfeel first. Softfeel has been created more than 10 years ago. It is an international brand with products sold in more than 90 countries now. The main mission of Softfeel is to simplify and secure the practice of aesthetic medicine. And for that, to complete that mission, we have created several tools. So of course, as you all know, we created the largest range of micro-cannulas on the market, the Softfeel Precision range. We have 22 sizes of micro-cannula for the body and for the face. We also developed a patented pre-hold device, the Softfeel Easy Guide, that eases the insertion of the cannula into the skin and that guides the cannula to the right insertion point. We have 8 sizes for the Softfeel Easy Guide. And lastly, we developed a Softfeel cosmetic range with 6 skincare products, Topilase, of course, but also skin rollers, the post-act mask, a hyaluronic acid-based mask, a massager, and a skin marker. So now I will let Dr. Sebban take the speech. Don't worry, we are recording the webinar, so the replay will be available from tomorrow on Softfeel Academy's website. And please don't hesitate to ask any questions, but all the questions will be answered at the end of the webinar. Thank you.
Thank you very much. Thank you all to being here. Thank you, of course, I will thank my colleagues to be a part of this webinar, and I'm very happy today to speak about this new product, very efficient and very useful in our practice. So why Topilase? Because you know that I use hyaluronic acid, of course, for injections since 22 years at the moment. And you know that I have the experience of filler injection with HA, of course. And I think it was very important for me to invent, to have a new product, because there was a gap in our practice to perfect our result. Usually when we are injecting, you know, now, and of course, currently we inject in 3D. We used to do volumetry, and we inject in different layers. So a lot of course, brand of HA are using different viscosity for each layer when we are injecting, in order to restore the aging process. So now we know that when we use to inject, we use different, you know, layers, meaning subcutaneous fat, the superficial fat, the deep fat, and the bone layer. And sometimes there is some mistake or migration into the skin, and there is some irregularities and side effects due to wrong injections. So as you see here, we have different side effects that we can observe. We have the Tyndall effect that we used to see when the injection was too superficial, as you see in the first picture, usually in the periorbital area. And usually it's very hard to remove and very, very, you know, difficult to leave for our patient. You can see the overcorrection, the overfill syndrome that we can see so much time and too much often currently. So this is due to too much injection every year of too much product, or in only one session. Of course, you know that we can have very large inflammation or edema around the lips, and immediately we can have swelling on the lips due to you know, the injection, the introduction of the needle or the cannula into the lips, and we can have granulomas. So you see here, I don't speak about embolism, because Topilase is not, you know, you know, effective for that. It's a product created only for improve the result and to be perfect and very artistic when we are injecting our patient. The next slide, you know that now we have only one solution until now. It was the injectable hyaluronidase, and you know that hyaluronidase is an enzyme which depolymerize the injected hyaluronic acid. So next slide. So you see that we have, of course, a lot of benefits due to hyaluronidase injectable, but we have a lot of drawbacks. And the benefits are very interesting because it's very efficient, of course. It is, you know, an action very fast. It's very easy to use for injector, and the result is very instant. But we have a lot of drawbacks, and drawbacks are, of course, you know, anaphylactic shock sometimes, and very allergic, you know, result. We can have edemas, we can have erythemas, and of course, as we do a very efficient, you know, reduction of hyaluronic acid injected, we can create sagging of the skin, a loss of volume, and a loss of firmness. And of course, everybody saw when we are injecting the hyaluronidase, we can see a diffusion. And sometimes there is, you know, an effect in another area that we are expecting. Usually the hyaluronidase it's animal, so we can have, you know, some side effect due to animal product. And of course, you know that in many countries it's forbidden for, you know, artistic result. It's only allows, sorry, for, you know, the vascular occlusion, but not for removing the irregularities. The next slide. So you know that on the market we have a lot of injectable hyaluronidase. Those hyaluronidase are usually cosmetic injectable, so it's not, you know, allows really in many countries, but we have only one hyaluronidase allows in Europe and in the world as a medical device. It's the hyalase, as you know, but very hard to find. The next slide. And why I create Topilase? Because, you know, I think that sometimes, and I see this kind of problem always in a week, I see a few person, usually who are coming for the first time, and they tell me that they have, you know, irregularity due to another injection, sometimes, you know, swelling under the eye, or you know, ball on the lips. And we see the patient for the first time, and we need to you know, enhance this kind of problem. So we want to remove the problem, of course, and we want to perfect the result, to have a really perfect result in a global concept. So what can we do except, you know, using cosmetic? So I was thinking about that 5 years ago, and slowly I worked with pharmacologists and with the dermatologist, and it was very interesting to invent a new way to perfect our result. And this way is the cosmetic, you know, to use in hyaluronidase in cosmetic. So this is a topical care, non-invasive, with a very interesting skin tolerance, no problem, no secondary effect. At this time, I never saw secondary effect and allergy, and no softening of the tissues. The next slide. So here you see that the vial, and you know that this product is French. The next, what this product contains. So we have 100% of natural origin ingredient. It was very important for me, and there is no conservator. And you have inside two compartments. The first compartment contains a powder. This powder mixes, you know, 3 enzymes: the hyaluronidase, the protease, and the lipase. And why? Because when I used at the beginning the hyaluronidase only, it was not effective, and I needed to improve the effect of you know, the introduction into the skin. So I wanted to go inside, of course. So I have play with 2 effects of the hyaluronidase. The first one is that hyaluronidase, it was proved, is a vector of penetration of different active principles, and hyaluronidase depolymerize hyaluronic acid injected. It doesn't act on own hyaluronic acid, because, as you know, we are, you know, we do hyaluronic acid every day. Our skin tissue is creating hyaluronic acid every day. So this complex is very interesting, because the synergy between all you know, enzymes help to penetrate the skin, but to go with the product contained in the lower compartment. This solution contains essential oils, aloe vera, and, you know, different you know, characteristic in order to have a good disinfection, in order to be a moisturizer, to conserve the firmness of the skin, and to decrease the swelling of injection. So when I use the complex mixed with the solution,